Thank you for joining us for the York Dispatch Roundtable discussion on heroin use in York County. Panelists today are York County Coroner Pam Gay, District Attorney Tom Kearney, York Dispatch Health reporter Molly Durkin, and I'm Christina Kaufman, reporter and project coach for the York Dispatch. Molly and I are two of the reporters who recently worked on a project examining York's heroin scourge and the significant increase in overdose deaths. This forum will explore many of the topics written about in the 5-day series that resulted from months of research and interviews. In our audience is York Dispatch publisher Dave Martins, editor Allison Cooper, and some special guests who spoke with Molly for stories she wrote for the project. Molly, would you introduce your guests?
Sure. Today we have Antoinette Sacco. She is the CEO of Colonial House. That's an inpatient and outpatient provider in York. And Phil Bauer, who is an advocate for prescription drug safety. His son, Mark, died in 2004 after a prescription drug overdose.
Well, thanks, both of you, for joining us and for sharing your stories with Molly and for the work you do in the community to raise awareness. Pam Gay was a new coroner last year, having recently been elected to the position, but it didn't take long into her tenure for a grim pattern to emerge. Pam, how many overdose deaths were there last year, and how did that compare to the year before?
Well, there were 110 overall overdose deaths, and out of those 110, 62 were heroin-related. Compared to the year before, we had 56, 57, I can't even remember the exact number, but it was in that range, total overdose deaths. I believe 57, and then out of those 57, 17 were heroin-related.
So we went from 17 deaths, heroin overdose in 2013 to 62?
62.
In 2014.
Just in 1 year's time. And actually the pattern had escalated pretty quickly into the year. So by February we knew we were, it looked like we were going to have a significantly higher number of heroin deaths.
So where are we year to date in 2015 compared to last year?
Well, we're very cautiously optimistic and glad to say, while it's still very tragic for the families that lost their loved ones, we have at this time 4 confirmed heroin-related deaths and another 5 that we're waiting on. So that's about half of where we were last year. So we're very thankful for that. We don't quite know why, but yet, as I tell everybody, we'll take what we can get, and hopefully we'll see that continue, so that to have a decrease. So.
Okay. Tom, we hear that there's a stigma about about heroin, and that the public would be surprised who's actually using. Who is using heroin?
Well, you're right. There used to be a stigma. People were called junkies, and it was generally a lower class people. The beatnik crowd, if you go back to the 50s, that kind of thing. But that's changed. And now what we're finding is that it's almost chic among young people to try this. And the people that we're seeing have changed in their socioeconomic class and many other factors such as age and race and all those kind of things.
So you're having, what I've heard from sources during the course of my research was that you're having football stars, the kids who didn't do drugs before are starting to try heroin?
That's correct. And the sad fact is the first time you take it can kill you. And that's what these young people don't understand. It can kill you on the first time that you do it. And if it doesn't do that, it will alter physically your brain chemistry, so that from that moment on, you will start to crave that drug.
Okay, so lifelong struggle.
Yes. People, you talk to addicts, and they will tell you it's one day at a time, 1 minute at a time. Right now, I'm just not going to use that drug, and that's what we see. It is by altering the brain chemistry and creating that craving, it's not as simple as I'm not going to use. And that's the bad news. But the good news is we've learned it's treatable. And with it's called MAT, medically assisted treatment and counseling. It can be cured.
Okay. Pam, do you have ideas about why that number, the number of overdose deaths has increased so much?
Well, it's a trend that we're seeing in all the surrounding counties, so I think it's logical that we would see it as one of the larger Class 3 counties in Pennsylvania. It initially started out in the bigger cities to see that trend upticking, but it didn't take long, I think, for us to be affected. We also obviously are geographically located to some major thoroughfares and major cities as a result, with Baltimore, Philly, and New York. My chief deputy tells me that the purity is so much higher, and this is what we hear from law enforcement, that it's definitely hooking people a lot faster to some extent. It's not a recreational drug. We try to tell kids that all the time when we're out in the schools, but I think sometimes they think initially when they start using it, it could be. And then it doesn't take long, once or twice, and they are addicted. If they survive, they're addicted. We hear that all the time, and we hear that from family members of decedents, that it only took them once or twice and they were hooked. So there's a lot of reasons, but those are some of the reasons that we see. A lot of our decedents are from the recovery houses, and or they've just got their, they've just cleaned up their life, and so many of them have been sober for a little while, and we think they're dying because they think that they can use at the same level that they once did, or the same dose that they once did, and they haven't built that tolerance up, and as a result, one or two times, once they have been clean, is enough to kill them. So that's the majority of what we see. So. And
we've heard that there are some origins in addiction with prescription medications. Can you talk about that?
And that is another component of this. We feel there is definitely a direct link to the prescription drug issue, the abuse that's taking place in our community as well as many others throughout this area, throughout the Northeast, and throughout the country. They used to be less expensive than heroin, but actually now prescription drugs are more expensive than heroin. And what's happening is people are using their prescription drugs, and there's more regulations, and there's going to be even more when the pharmacy database program comes into place, or the prescription database monitoring program. And we feel that basically it's easier for people to make that crossover then as a result. Heroin's a lot less expensive. And for some individuals who really are addicted to those opiates, it's a very easy transition for many of them.
Yeah, the national statistics, one study that I read said that 80% of heroin users have first abused prescription medication.
Okay. One of the terms that emerged early on as I started researching this, and I assumed that it was just because I'm an adult of my age, but I'd never heard of the term Skittles party. What's a Skittles party?
Well, that's basically prescription drugs that a lot of kids go into their friends' homes and their friends' parents' homes, and they'll go into cabinets and they'll collect, or they'll bring them to school. They'll collect their own parents' pills that are left over, old or unused, and we're told that they actually put them in a bowl. Sometimes they put them in Ziploc baggies. And they basically share at parties and with alcohol, quite often. And, you don't know what you're getting at any given moment. It's sort of like a thrill thing, risk-taking thing, and they get a kick out of it, and they want to see how everybody reacts. And unfortunately, people die from that, so.
I've also heard the term farm party used, PHARM. That's another term that is used for pretty much the same thing, I believe.
Okay. So for parents out there, what advice could you give them on that?
We do this, Pam and I and members of our offices go out to schools and town halls. We love to speak about this. First thing you can do is clean out your medicine cabinet, because to prevent precisely the kind of thing we were talking about. Your children's friends, and it doesn't necessarily even be your children's friends. It could be your friends who are addicted, who are going into your medicine cabinet as they go use the toilet. So clean it out. We have instituted a program. Most police stations have a drug drop box. You know, I mean, we're York Countyans. We like to save money. So if we get a prescription medication and we don't use it all, we'll keep it in our medicine cabinet for next time I feel a little bit of pain here. And that's what we do, okay? But we've got to know how really dumb that can be, because you can, you know, be contributing to something that you have no knowledge you're even doing, because you know, whether there's 10 pills in that jar or 3 pills, you probably have long forgotten. So that's the first thing you can do. Get rid of, you know, get rid of your old medication, and when you're done using it. The other thing you can do is be aware. Pam puts on a great program, and maybe I should defer to her about the things that you look for. You know, how do you know if your child's on heroin? I mean, what are the signs you look for, Pam?
Well, you look for pinpoint pupils, you know, real small pupils, and sometimes that's hard to tell. But if their eyes look a little funny, that could be, you know, an indication that they have those constricted or pinpoint pupils. They get the nods. They fall asleep when they're using opiates or heroin, and you know, you can be in the middle of a conversation and they're fighting hard to stay awake. That's a classic sign of heroin abuse or opiate abuse. They start to steal. They start to lie, as with a lot of addictions. You know, you can give them cash. They'll ask for cash, or they go through their cash pretty readily. You're going to see maybe spoons that have burn marks on them from cooking the heroin up. That's if they're injecting. Sometimes they'll do that even, you know, they'll cook things up on the foil and then snort it, that kind of thing. So burn pieces of foil with burn marks on them, or brown marks from cooking that. You know, they'll have lighters around. And of course, they're not laying any of this where you can see it very easily, so we encourage parents to search. And I know that's controversial with some parents.
If you suspect.
But if you suspect, certainly get involved in search. They hide things behind their switch plates of their, you know, in their room. They hide things in their dresser drawers, obviously, in their purses. And so get involved. You know, we try to tell parents, get involved. Don't be afraid, because you know, and you know, I'm sure Phil would tell you too. He's a proponent of it all the time. You know, get involved, and you would certainly do better by being involved now rather than, you know. And there are a lot of parents that are involved, even who kids do use and eventually can die. But I think the more involved you are, and the more that you're not afraid of, you know, maybe making them uncomfortable with some questions and whatever, I think it will definitely bode you well in the long run, because it shows you're a, you know, caring parent, whether they realize it or not at the time. And you can hopefully get on top of some of these issues before they get out of control.
I would follow that up with go out and look in the cars that they drive. You know, rarely, when my children were growing up, rarely did I just go in their car. It was pretty much their car. But that's something where we frequently find this in traffic stops.
Okay. 2 things I did want to mention to revisit, at least on the pills. We've heard stories of kids going to visit their grandparents, and the grandparents, the last thing they think, especially if it's not a child who's been in trouble before, if it's, you know, little Jane or Bobby who always does good in school, it's an athlete, that they wouldn't, you know, necessarily suspect that. And the other is, we've also heard about people who go to open houses when there's real estate for sale and go rummaging. So is there, the general public should be aware of this?
Yeah, we try to make them aware of that when we do our town hall forums. But yeah, I had heard about that, but I wasn't sure how much of that really went on until we met with Delaware County, and they told us, yeah, that, you know, they actually have a real estate person on their task force who addresses that with the realtors, that they, you know, use these open houses to, when they're out looking at the houses, they ask to use the bathroom, and, you know, that's where they find stuff. And like Tom was saying, you know, D.A. Kearney was saying that sometimes people don't realize how many pills they have left anyway. So it can be a real subtle, slow process. But if you go to enough types of homes, or your friends' parents' homes, you know, you can eventually, you know, get a collection. And some of these kids are not just using it, some of them are selling it. And we want to point out that that's technically illegal. And, you know, you could face prosecution for that. So when we're out in the schools, we try to explain that while it may be legal drugs for that person, it's only legal for that person. It's not really legal for anybody else.
Right.
Because I think there's this concept that because it's a legal prescription, that that's not near as bad, and I'll be all right, you know.
Okay.
And I do want to add, you know, typical brand names that you'll see for prescription opioids are really common, like Vicodin, Percocet. You know, I was just on Percocet when I broke my ankle. So these are not things that, you know, you need to be really hurt to get prescribed.
Okay.
And some of these drugs used to be for end-of-life treatment of like cancer pain or, you know, really terminal related pain. And now they're being prescribed for lots of things. And, you know, there's definitely lots of data and research that shows when the opioid problem really increased and opiates was when the synthetic opioids came out in the early 90s, and we started to see an uptick in the heroin deaths as, you know, along that same line. Okay. You know, it's just pretty much parallel. So
makes sense. In many of the people that Molly and I had profiled in writing stories about overdose victims, it seemed that a recurring theme was that a person would have potentially not been a fatal overdose if they had had intervention earlier. In one of the cases I wrote about, there was a Dover man who he was in a hotel room with a woman, and he had started overdosing, and there were several hours that she spent on Facebook writing texts, avoiding calling the police. Mm-hmm. But state legislators have taken some action to reduce that number of overdoses and those types of scenarios. Tom, can you talk a bit about the Good Samaritan law?
Sure. This law went into effect on November 30th of last year. It was Act 139 of 2014, if anybody wants to look it up on the internet. It does a couple of things that are really important. One is the Good Samaritan law. And what that says is that if you either take someone to the hospital who is overdosing and remain, or you contact 911 and give your name and then stay until help arrives, you are immune from prosecution. Not only are you immune from prosecution, but the person who is overdosing is immune from prosecution. And these are for misdemeanor offenses. Now, if you're delivering drugs, okay, that are going to result in death, that's a whole other thing. Although we would certainly take that into account on sentencing.
But if you're just a person who's with somebody, another user, and the user that you were with is overdosing. That's
right. What we find is generally usage occurs among a group of people. Not always, but many times it does. And then when someone starts overdosing, people don't know what to do. And you can see, you look at the evidence afterwards. They're texting their friends, and eventually they just scatter, okay, and leave, and the individual dies. And what this law is designed to do is to let people know. And this is a message that that Pam and I would very much like to get out to the community, and that is that you are immune if you call for help, and you stay and do the reasonable things that one would do if you're a Good Samaritan. As a matter of fact, I have dismissed cases which occurred before November 30. Because I have felt the intention of the law, as given to me by the legislature, it would be unjust to prosecute people who did just that. Many times a parent will walk into a room and see a child has overdosed. I'm pleased to report that I don't prosecute those children because they fall under the Good Samaritan law. So it's not only people who are using together with, but it's if you come into contact with someone. So that's one aspect of that law.
So you're actually seeing cases of this now, and do you actually attribute the decrease that Pam is seeing at all to the Good Samaritan law, the fact that people...
I think it's too early to tell. The answer to your first part of your question is yes. We are actually seeing that taking place, and I have dismissed cases. I'm going to say probably, I'm estimating, but probably about 5 to 7 thus far. As a matter of fact, I did one this morning that happened before November 30 because it fit into that category. So whether that's having an effect or not, I think it's too early to tell.
Okay. The legislation also allowed for Narcan to be carried.
Yes.
I see you have your...
Can you please open that?
Sure. Naloxone, which is the generic name for the drug, it goes by the trade name Narcan, is a drug. I should defer to the coroner here, but my understanding is it immediately reverses the effects of opiate medications. So if you were using heroin and you're still breathing, or you're still alive, you may not even be breathing at that point, but if you're still alive and this is administered, there is an excellent chance that it will reverse the effects and allow you to live. We were able to, this new law that was passed, Act 139, permitted us to permitted law enforcement, who are usually, many occasions, the first responders, to carry Narcan. It also allows EMS to carry Narcan. Previously, only paramedics were permitted to do so. We have in York County taken a countywide approach, and with the blessing of our commissioners, as of last Monday, we distributed partially the drugs and kits that we had available. And I'm pleased to report, from here, before I got here today, I was up at Northern Regional and we had our first save 2 days after we made partial distribution.
So some York County police officers are carrying it now,
yes.
And we recently, you said 2 days ago, had our first...
No, we recently used it last night.
Oh, wow.
After
Okay.
it had been distributed 2 days ago. A life of a 61-year-old male in Conewago Township, his life was saved as a result of a Northern Regional officer. He was taking OxyContin, I believe, or oxycodone through prescription medication, and he had overdosed.
So naloxone works on those prescriptions so that people can overdose on in addition to heroin?
Oh yeah, it works on any opiate, pretty much.
Yeah.
So what actually happens when naloxone is administered? What does it do? I know that there's been some confusion about whether that's it, the person's okay, or whether they need additional medical treatment.
Well, they should be monitored. So they're going to be taken right to the hospital and monitored for a while. Sometimes, you can't force somebody to stay and get evaluated and things like that. So sometimes they walk away. 5-6 hours later, they're discharged.
Okay.
And yes, sometimes they go back and they use again. We understand that this is not the cure. We realize that we have to stop the bleeding, and that's really what this helps us do a little bit. And at the same time, maybe it'll save that one person who thinks, oh my goodness, I almost died. I really need to get into therapy, I need to get into detox and then into some sort of recovery and therapy. So, if we get a few people to reconsider and the fact that their lives have been saved, that's certainly better than 62 deaths.
Right.
And we're going to use this as one spoke in the wheel of what we think is a very multifaceted approach to solving this problem, or at least decreasing these deaths, and trying to get the word out there about the dangers of usage. And so we're excited about it, but at the same time, we realize it's not the total answer. But we do think if lives are going to be saved, then it's well worth it. So.
Okay.
And under this law, can families attain naloxone?
Yes, and that's the second thing I would like to communicate to your viewers. The law allows any individual to go to their doctor and request a prescription for the drug, and not only for themselves, but if you are a parent or have someone in your family where you live that you suspect may be using opiates, you can obtain a prescription. Let's face it, law enforcement's EMS providers are not the people who are first discovering these individuals. It's generally family members. So, I would urge your viewers, if they feel that they may have a problem in that regard, to seek their doctor. And if there's any reluctance on the part of the doctor, call the coroner.
We can give them the memo. There's a memo that's been put out, from the state that they can actually take to their physician and explain that, this is okay to do. We promise.
Yeah.
And
Yes.
please do this so that this family can get what they need.
And the thing about it is, the law also grants immunity to not only the provider, the medical provider of the drug, if he or she does it in good faith, as well as the individual who administers that drug. Now, there is some training available as to how to use the drug, and that's at getnaloxonenow.org. It's a 15-minute training. I've taken it myself. All of our law enforcement who are out there prescribing the drug have taken the training. And it would be helpful to anyone who obtains the drug. If I were a doctor, I'd want to make sure that you knew how to administer it. So,
And how is it administered?
It can be administered one of two ways, either through injection, which is one way to do it. The second way, and the way we have chosen here to do it in York County, is to nasally administer it. Basically, it involves a little
Atomizer?
Syringe and atomizer, and I can show it to you.
Like a nasal spray?
Sure. It's,
So it acts very quickly.
Yeah, okay.
Within seconds, actually.
Yeah, what you do, here it is. It's got a little syringe without a needle. It's got a little thing that has the drug in. You put it in, okay, and there's something called an atomizer, which is a little triangular shaped thing that you put on the end of the syringe, and you shoot it up somebody's nose, both nostrils. And if it doesn't work, you apply it again within a couple minutes.
Okay.
And I want to point out, too, that drug's been around for a long time, and as a nurse, and many of us have been giving that in the emergency room as well as up on the floors. And if you have a parent, an aging parent, especially a senior citizen who is on any kind of narcotics, you definitely want to consider getting a script, to keep in your home also for that reason, because sometimes they're over-medicated, they get mixed up, they take too many of certain things, and we're really trying to get the word out there that it can be used in that way also.
That's what happened today.
The 61-year-old?
Yes.
Okay. Molly, your side of the project dealt pretty heavily with treatment, and it seemed like your sources seemed to suggest that we needed better access to treatment in York. Can you talk about what your research found?
Absolutely. We have several treatment centers in York, and I was, part of me expected to hear that, beds weren't available or people were having trouble getting into treatment, but I think in my reporting, I found that one of the biggest barriers is funding treatment. There are several different ways people can get funding. Private insurance has certain minimum requirements that they're required to give out to patients, and medical assistance can cover some, but not every rehab is going to take private funding. Not every rehab is going to take medical assistance. So I think it's really important for people to realize that if you don't have the means to get this treatment, then you might be out of luck. Fortunately, we have a system in the county that helps those cases. They prioritize pregnant substance abuse users, the people that are really down and out, who have had multiple attempts at detox and everything like that. And I guess I should mention that the best way for a heroin user who wants to get clean is to have a continuum of treatment. That's what providers have been telling me. They say, once you detox, it's probably best to move to inpatient treatment or rehab. And then when you get out, you don't go back to the environment that you were using in. You go to a halfway house or a recovery house and continue that outpatient treatment and find that support, because your chances of relapsing are so much greater if you return to the environment you were using in. Antoinette, the CEO of Colonial House, as I mentioned, she runs an inpatient and outpatient treatment center. Do you have anything you want to add as far as, the struggles that your clients face? I do know that it's very hard to get a heroin user into treatment because of just the withdrawal process and everything. So can you speak on that a little bit?
Yeah. Yes. Over the years, it seems like when they started implementing the use of things like Suboxone, and medicated assisted treatment into the detox process, heroin addicts had a better chance of staying invested in detox because, as you had mentioned earlier, the physical withdrawal symptoms are pretty severe, and I'm not medically informed enough to say that you can't die from a heroin overdose, but my experience with a lot of our clients is that it feels like you're going to die. Mm-hmm. And so they may make the second or third day and bolt out of a detox facility and go back out and use. And it seemed that when they started implementing medicated assisted treatment for detox, people stayed.
Are you saying it feels to the person who's withdrawing like they're going to die from that withdrawal?
It is a physical withdrawal. I've described it as being 120 years old and having arthritis, rheumatism, and pneumonia all at one time. It just every bone, muscle, joint aches. Your nose is running, your eyes, your stomach, and it's just encompasses a lot.
But you can't overcome that.
You can overcome that, yes, definitely.
And something I learned too in my reporting is that, after that really acute phase of withdrawal, you're not done yet. You have like months, up to 18 months of post-acute withdrawal symptoms where you're constantly thinking about it. You get those cravings, and that's just, keeping the person at risk. And that's why that support is so important. And I think it's also important to note that, not every treatment option works for everybody. Everybody is different in their treatment, and I think a great example of that is on our final day of our series, I ran a story on a young man, he was 23, who had been to 8 rehabs. None worked for him. He got kicked out of the last one, was at the lowest point in his life, and he found support through a church. And now he goes to support groups every day, and he has what he needs. And thankfully, he's been clean since October of last year. So right. I think no matter how many times you really have to try to get clean, you just have to keep trying.
All right, very good. Pam, there have been various efforts on behalf of numerous county officials. Can you talk a little bit about the York County Heroin Task Force and its mission, and what kind of resources, like where people can go if they want to get clean, if they suspect that a child is using, that sort of thing?
Well, the Heroin Task Force was formed in July of last year, and actually what had been happening is, a couple weeks, months before that, the coroner's office had already been out talking a little bit about this problem in schools and actually in a church. And ADA Sunday and Claude Stabley and I went to Crossroads United Methodist and talked about this. It was publicized in the paper, and at that point, we were already figuring that we were going to form a task force, and then a short time later, the task force was formed. And the task force consists of a lot of individuals from the community. We have physicians, we have addiction specialists, we have people in recovery, people that run recovery homes. We have people from the DA's office. We have law enforcement, people from the coroner's office. We have a mother who lost her child to a heroin overdose. So we're coming from all different aspects and looking at the problem. And we really wanted to be a task force that attacks it and actually does something instead of just talking about the issue over and over again, which is what often happens in these committees and task forces. But we felt that one of the things we really needed to do, we have legislators on the task force too. We thought, let's see what we can do about letters of support for different legislative bills that are in existence. And so we did that. We knew that we needed to get education into the schools somehow. We don't have a formalized system of doing that yet, but we're working on that. But in the meantime, the coroner's office and various task force members are going out into the schools during the day, and also we're doing the town hall community forums at night, which allows the general public to come and ask their questions during the second hour usually, and tell us where the problems are in their community. And that has been very helpful because we're learning a lot, and that's where we found, even though we suspected, but that's where we found a lot of confirmation about the treatment problems and the funding, and also just the ability to get into the detox and being on a waiting list for many.
I understand you guys were really surprised too by where you were finding there were problems. Red Lion. rural places in York
Delta,
County.
which we knew there was a problem in Delta, but
There were 200 people that showed up in Delta.
yeah.
I mean, that's all of Delta.
Yeah.
So that was,
and there's no NA meetings. There were no NA meetings out there. So that made it difficult for people that live at the southern end of the county to, where do you go to get that help?
Where do
at
they go?
least that consistent support group that you can talk with, and sponsors to help you. And so we're really pleased. Delta took, they really took the initiative to try and bring their community back to what their control instead of the dealer's control. And they've been working with PSP. The DA will tell you that they have their own stakeholders group now. They have their own Narcan meetings going on down there now. So we realize that there's a lot that still needs to be done, but we're focusing on treatment and education right now. And one of the things that we're looking at too is we know that there needs to be some sort of guidelines or regulations or something we feel for the recovery houses, because that's where a lot of our deaths are occurring or shortly thereafter. So we're hearing from people in the recovery community that there are some good houses and there are some that aren't so good. And what can we do to try and improve that? Because that's not giving that person the ability to really survive to some extent, because they get into those houses. There's other users quite frequently. They're preyed upon by dealers when they leave the house to go look for their job that they're required to do, that kind of thing, or when they go to work. So, we're also hearing that when people get out of prison and go to a halfway house, there's just not the support there that they need. We would certainly rather, if there's a way we could put some of that funding into treatment rather than incarceration. It's been much more cost effective, as we know, and and certainly better than the alternative of being dead.
Yeah.
So
it was interesting when we went to these town halls. Our goal was to educate. That is, how would you know if your children are using heroin, and what would you do about it? Okay, and what we found was that we were being educated ourselves as to the gaps in our community as far as treatment and what needed to do. And it's been very educational for all of us involved. And taking that back to the people on the task force who are in a position to make things happen, like our legislators, has been very, very important.
and we
What's
have
that
county
website, and how
county
can people
commissioners.
learn more about that?
I'm sorry?
What is that website?
StopHeroinDeaths.org is the task force website. And the other thing I want to point out is we have got the detox cap improved as far as they're able to take more in both detox and I believe the methadone clinic also just got their beds increased. So we do see some positive changes for the York community, but we're hoping that will continue, obviously. So.
Yeah, in addition to not only the educational piece and the treatment piece, we've also looked at, based on what we were hearing, changes in the way we go after the people who are
That was my next question
selling,
for you.
Okay,
Yeah,
selling
how are
heroin
police
and bringing, this drug into our community. One of the things, it used to be that, our police would show up and a person would be laying there with a needle sticking out of their arm and okay, this is a job for the coroner and I'm moving on to my next case. Okay, well, that's a crime scene. And our police now understand that. And and it may be as simple as looking in the person's cell phone, or talking to their roommates, or finding out where they got the drugs, and then going after that individual in order to ensure that drug, which has caused an overdose, and many times drugs are laced with things, either it's the purity or they're laced with something like fentanyl, which we frequently see, which are going to cause instant death. Because
that's the name of some of the packets.
Yeah,
Instant death.
we see that we the packets come labeled. Okay.
Why you would buy that, I don't know, but people do.
Yes. So what we're able to do then is pursue those individuals and follow up. And the coroner's office has been very helpful because one of the things they did was start to do autopsies of all drug-related deaths, because as prosecutors, we need to show that person didn't have some other condition which caused the death, that the death was in fact caused by the heroin overdose, and that's what an autopsy does. So by changing our strategy and focusing on, the things that are causing death in our community, it's one of the aspects that we did through the heroin task force as we heard from the community.
Yeah.
I just want to clarify that we're doing autopsies on the heroin-related deaths. We're not doing it on all the drug deaths yet. That's actually a recommendation from the National Association of Medical Examiners. But I just obviously we felt that that would be a tremendous strain on the budget, even though it is recommended. And I kind of checked what other counties are doing before we changed this policy, because in the past we had only done toxicology most of the time on these deaths. So now we felt that because, we met with the DA's office, we felt because these are more easily prosecutable, although they're still very difficult to prosecute, that let's see if we can maybe focus on the heroin-related deaths now. So that's sort of the first step of this. Ideally, it would be nice to be able to do autopsies on all the drug-related deaths, but we're not quite there yet. There are some counties that do.
So if you do an autopsy and you determine that the death was not caused by any natural cause, the only thing that could have caused that death was the overdose, then you can tell the DA, and the DA can look through their phone records and use other information to find out. So is that happening? How are police going after the dealers? You said.
Suffice it to say, we're doing it. As far as the tactics that are used, it's probably, I don't want to alert those people who are, coming into as investigative sources. But my point is that we are viewing that, that death as a crime scene where we sometimes didn't before and just moved on to the next call. I mean, the police are busy, but we have to, prioritize, and now law enforcement, because of what we're seeing, because of this uptick. And it's not only York County, it's all over the state. I meet twice a year with my fellow prosecutors across the state, and every one of them seeing it. And I read in the country that that's the case as well. So this is just an example of where we are as a society, and this is our little house, and we want to see what we can do to make it better. And part of that's the change in tactics and the education and the treatment aspect, and as well as legislation, which we're focusing on. We believe in the Heroin Task Force that some of these sober houses need to be regulated. And that's a constant theme we are hearing as we move through the meetings that we're hearing.
And I do want to say that as a new coroner, I really am appreciative to the police chiefs who gave me the opportunity to present this whole concept and this policy change, and then embraced it and really took that back to their officers. And so we're really thankful. I see officers sometimes when I'm dumping our meds at the incinerator, and I thank them for what they're doing. I know some of them it's a pain. Now they have the drop boxes, and they're having to schedule time to drop those boxes at the incinerator, the Solid Waste Authority. But I thank them whenever I see them for doing that, because that's just one step of combating this problem. So. Okay,
and is there the stopheroindeath.org?
Deaths. It's plural. Yeah, stopheroindeaths.org. Yeah.
Does that provide information on how people can dispose of unwanted drugs?
I really don't know for sure if we have that on there. I have to check.
The York County Solid Waste Authority
but I would contact the York County Solid Waste Authority. They'll work with you. They're great. But generally get those meds to your local police department, because that's where the drop boxes are. Now, they can't take syringes there, but you can talk to the Solid Waste Authority about how to discard that. But we really request that people not put it back into the water system by flushing them. I know that's really what had been done in the past, and I think there's actually still some websites that suggest that. But,
curing one problem, causing another.
We just really request that you not do that.
One example of a liquid medication, if you just pour it in with cat litter, it absorbs it. Absorb it, and then you can put it out with the trash.
Okay. And I've also heard that mixing it with cat litter or something else that's not good to eat can help when people go through the trash and family
deter
members
people who would otherwise maybe try to get those drugs.
Yeah, just make it unpalatable.
Did you have any other questions for the panel?
I did want to ask, since we've talked a lot about just different awareness efforts that have happened over the past year. I know last year was a bad year for heroin deaths, but do you guys have a sense that we are making a difference by putting a big spotlight on this?
Oh, I definitely think the media attention helps. I know that some people probably are heroin tired. When I say that, heroin fatigue, whatever you want to call it, because I know some people get tired of hearing about things, and I'm aware of that. But just like with the suicide problem in this county, I just feel like we have to keep talking about it. I appreciate what you guys are doing, all the media, when we get the attention on our town halls, when they come out and when they promote them. All that helps tremendously, I think. And in the long run, I think there are still people that don't really know that this problem exists. So we're going to keep going out there wherever we can, wherever we're invited to get this message out. And I think I'm hearing more and more about people who are very aware now that this is a real big problem and that the prescription drug problem is a real big problem in York. And that's exciting to me that they know that, because I feel like, wow, somehow all of the things together, that all the efforts are really coming together, and we're not all doing our own little thing, and hopefully we're jointly working towards the same idea of trying to decrease these deaths and to stop the abuse. So.
I would say that partnering with the media definitely has an advantage. I mean, I think things like cigarettes, okay, and what we've seen in the decline of people that are smoking as compared, say, to Europe, okay, or alcohol, drinking and driving, okay, and the media attention on that. Seat belts, another example. I mean, as these things are pointed out and made known, people will say, hey, I gotta watch myself because I'm gonna get caught if I drink and drive. Okay, and so I think it does definitely make a difference. And, I join with Pam. I'm very grateful to the media for allowing us this opportunity, as well as many others, to put this in front of, our community, because it does make a difference.
Well, I'm glad we were able to have a little bit of hope here at the end of the program. It sounds like there are things that are working. And did either of you have any final thoughts that you think should be shared?
I'd like to reiterate, get naloxone if you have a problem. Remember, we will not prosecute under the Good Samaritan law, where the people are immune from prosecution, and work on your medicine cabinets. And finally, discuss it with your children and keep after them, because, just one time of being young and stupid, and we all were, okay, can kill you. And that's what we don't want to see.
Final thought, Pam?
I just definitely be aggressive with checking your kid's room, their car, as D.A. Kearney said, and definitely know who their friends are, and try to, stay close to them and as much as possible. Is that going to always be the solution? No, but it's one way. We just want to continue to get the message out there, and especially into the schools. And we're going to be working on that, and they're going to hear more about that eventually from the task force. So we want to start young. I think it's never too early for drug education. Obviously, wouldn't necessarily do my heroin presentation at the elementary school, but we would, gear it down, and we're working with some entities that are going to help us do that. So.
Okay, great. Well, on behalf of the York Dispatch, thank you very much for watching, and stay safe.
Thank you.
All right. Thank you, guys.
Phil, how'd we do?
Okay, good.